My name is Dr. Oswin Choga. I'm the technical advisor for Coopers at my house.
Today I'm going to be covering a topic called the management of terroriosis or January disease.
So now trying to drill down into what a farmer should do in the case that they are faced with an outbreak. They've got an animal that they suspect is got January disease. The most important thing is to try and speak to the experts, but in the event that the experts are not there, one of the critical things that farmers should do is to identify the disease early, because the earlier they identify the disease, the much easier it will be to treat. Because if they identify it too late, the most likely sign would be that the lungs will be full of water. And as a result, if the lungs are full of water or have got lung edema, it means that that animal will die as a result of struggling to breathe, because it can't get in enough air for it to survive. Okay, so the later you try to treat it, the more difficult it becomes. So in the case of an outbreak, we recommend the first thing, because remember, the first sign that we see is an increase in temperature. Okay, so in the case that a farmer suspects that they've got a problem, what they should do is to take temperatures of all of their animals. Okay, and all the animals that will have a temperature that's more than 39.5, they would need to put it aside, and it will require a certain treatment protocol, which I'll talk about. But for those animals that will have a temperature that's less than 39.5, we recommend blocking or block treating with octitetracyclines. For example, we've got tetroxy or cupamycin LA. And this basically limits the multiplication of the parasite within the animal's body, such that if it's got a low level of infection, the animal will be able to fight the infection and ultimately develop a certain level of immunity in those animals that have a temperature. But those that will have a temperature that's more than 39.5, they would need to treat it with cupamycin LA or tetroxy, and they would need to use a drug that contains what we call diuretics that allow to drain the water from the lung so that the animal can poly. And an example of such drugs would be Perfexoplas, which kills the parasite causing January disease, but also it drains the fluid from the lungs, and the animal can breathe better, and it's got a better chance of survival. It increases the chances of the animal surviving after treatment by 30%, which is a significant number. Then the third treatment, because remember, I spoke about January disease being immunosuppressive, and most of our cattle, big carriers of red water, ghost sickness, and they would need to now treat those animals with arsenic red water, and that can be done through usage of drugs that contain diminuers in their saturate. Okay, so basically that's the treatment that's recommended when it comes to January disease. And the farmers should now continuously now monitor the temperatures on every 3 days up to about 2 weeks. And one thing that farmers should be aware of is that once you've identified that you've got January disease, it doesn't mean that if you treat, the animals will stop dying kind of bit, because remember, the animals are still spreading, and we've got some animals that we are not seeing that are sick. That's why we recommend block treating and a rigorous monitoring within trying to manage that disease. Okay, so in conclusion, what I would recommend farmers is to be rigorous in terms of dipping their cattle, and they can use all the different groups of dips, and they will be effective in terms of controlling brown ear ticks. It's just a matter of making sure that whenever you've got a challenge, you've got the dipping frequency right, because remember, this is a fast feeder, so the more we dip, the better we are able to control it. When it comes to the disease, there are a few pointers to making sure that as a farmer you are successful in terms of treating the disease. And these pointers, the first pointer is to diagnose or pick up the disease early. The earlier you pick up the disease, the much cheaper it will be for you to treat the animal, but also the much easier it will be for the animal to recover. Because as the disease progresses, our animal may end up with anemia. So if the anemia is too severe, even if you treat it, it will not survive. Then the third pointer is to make sure that we treat the concurrent disease. And the concurrent diseases are red water and core sickness. So that's why it's important that we follow the treatment protocol that I've given you. Then the third important pointer is to make sure once you are in the case of an outbreak, you continue monitoring those animals, even as you have treated. Continue monitoring those animals through the taking of temperature on a 3-day basis. The reason is January disease is not very easy to diagnose. In the case that you've got an outbreak and you've diagnosed one animal, it's critical that you now use the temperature as a way of picking it up. Then the fourth critical thing is that tick control is very important, because remember, the biggest challenge is that we've got infected ticks within our pastures. So once a farmer is faced with an outbreak, they would need to dip their animals on a 4-day cycle. And the reason is what to try to clear all the ticks that are in the environment that are infected, because the infected ticks will actually be in the environment and not only on the sick animals. Thank you.